gentlemen, welcome to Global Health. This is your host, Dr. Yavuz Selim Sılay. Very excited to host a very special guest. As you know, we are bringing very unique people from different backgrounds. And today, again, women's health has become one of the top of our agendas. We'll talk about the silent threat in women's health, known as fibroids, and we are bringing one of the top physicians. Professor Dr. Başak Çetiner Baksu is with us today. She's joining us from Istanbul studios, and I'm so excited to host her here today because she has an amazing background as a top obstetrics and gynecologist professor. Very excited to have her. Professor Dr. Başak Çetiner Baksu, welcome to Global Health.
Thank you very much for your kind invitation, and I am really glad to have the chance to speak to such a great population of viewers. Thank you very much for the chance.
Thank you, thank you. We are excited to have you because you have immense background in terms of obstetrics and gynecology. You're seeing variety of women's health, but today we picked a very important topic, which is the silent threat in women's health, and would love to learn from you about fibroids. Can you tell what fibroids are? How quite common are the fibroids, and what exactly fibroids is, and which organs do they form?
Yes, this topic is something that really touches my heart because I have seen throughout the years how women silently suffer from the myomas and they are afraid of losing their uterus. So this topic is really one of the most important issues of modern gynecology, where we now offer women organ-preserving treatment chances. So this is really something special for me to talk about.
Absolutely.
The fibroids are benign conditions. They are non-cancerous, and they are the growth of the soft tissues, the muscles and the fibrous tissues of the uterus. So they grow from the uterus, and they are one of the most common conditions that we see in gynecology.
How common is it actually, Başak Hanım? From your perspective?
Studies show that almost 70 to 80% of the women will have a myoma by the age of 50. That is, almost 2/3 of the patients have at least one myoma throughout their lifespan. And 1/3 of these patients will have symptoms that will affect their personal and professional life quality. It depends, of course, on the signs and the symptoms, but they are the most common pathologies we see related to the uterus.
I see. So you're seeing lots of these patients in Istanbul. And I'm very curious, Professor Dr. Başak Çetiner Baksu, about the cause of fibroids. What causes them?
Actually, the exact cause is not known, but looking at the patient's profile, they are seen most commonly between 16 years and 15 years of age. That is when the estrogen levels are at their highest. That means they are estrogen dependent. Therefore, hormonal effects of estrogen and progesterone is the most important issue for their etiology. But there are also other risk factors. For example, if your family, one of the family members of your family, like the mother or your sister or aunt, has a myoma, the risks of you having a myoma also increases. There are also some ethnic susceptibilities, like in the African descent woman, that is related to the genetic variants or genetic mutations.
I see.
The other cause is age, of course. Between 30 and 50, they're at their maximum level. Having menstruation at an earlier age, the menarche age at an earlier age, like 10, 11, this causes for you to be exposed to estrogen for a longer period of time. Or having late menopause, which is the same thing, having estrogen for a long duration of time. Having not having any vaginal deliveries or not having any babies, having not delivered before is another risk factor. Obesity, because fat tissue stores the estrogen, so it is another extra source for these tissues to grow. One more thing related to the especially the African descent women is vitamin D deficiency. Studies also show a causative relationship between vitamin D deficiency and myomas.
Amazing. I'm so impressed. So there are many reasons, like you mentioned, hormonal imbalance, genetic factors, environmental influences. And can you tell for our viewers, especially our women viewers, what are the symptoms, what they see in terms of the symptoms they should suspect as a woman about the fibroids, and if they have like pain or bleeding or infertility, how significant are these signs?
Actually, most of the women are not aware that they have a myoma if they never go to see a gynecologist yearly. They are asymptomatic and most of them are accidentally diagnosed. But when they are diagnosed, this means they are at their most severe stages where actually they might have been prevented or might have an intervention. Another thing is pain. It can be a pelvic pain, it can be a back pain, it can be a bloating in the abdomen, or they might cause constipation because of the effect they cause on the bladder due to pressure. There might be frequent urination or frequent urinary tract infections because of the pressure they cause on the bladder. There might be another reason for infertility or having, even though they get pregnant, the chances of delivery are low because of the pregnancy complications. These are the most important, or having your abdomen getting bigger and bigger in a short period of time. These are all the symptoms that you should be aware of.
Amazing. So when a patient comes to you, Dr. Başak Çetiner Baksu, can you actually diagnose it? I mean, is ultrasound or MRI important in the diagnosis? I'm very curious about the diagnosis.
Yes, if a patient comes, in medicine, the first thing is taking a detailed history. So the history is the most important thing, beginning with the diagnosis. Then we do the gynecological examination, manual examination. We look at the size of the uterus, if there is abnormalities like any bulging, or if the uterus is mobile or not. So this is the manual examination. The last thing normally is the ultrasound. This is the most one of the most diagnostic imaging techniques, and it is easy. But in cases where you are not so sure because the mass might be related to the ovary, so you cannot differentiate where it is originating from, or when you are planning a surgery for a complicated case, then you can ask for a MRI. And in cases where you cannot differentiate the myomas from an endometrial pathology like the polyps, because the myoma might be originating from the adjacent inner layers of the uterus, then you go on to doing saline infusion ultrasonography and also diagnostic hysteroscopy. But the last three are the more detailed diagnostic tests, but the history, physical examination, and ultrasound are the main things that most of the myomas might be diagnosed.
Amazing. So one more question in terms of the treatment. Do all fibroids require treatment? As you mentioned, we all know that some are very small, some grow to very large sizes. In which cases, Dr. Baksu, actually the treatment is necessary?
As I have mentioned, most of them are very small and they do not cause any symptoms. the treatment depends on 4 factors. One is the woman's age. Second, the desire for future fertility. Third, the size and the number and the location of the fibroids. And the third is the symptoms. The fourth is the symptoms.
Yes.
So we review all these factors to decide for the treatment. But of course, if a patient comes with a complaint and you diagnose a myoma, most of the time there is an indication for some sort of an intervention.
Absolutely.
But preserving the uterus is our main goal, even though the woman has finished her child desire, even though she is in the menopausal period. Modern gynecology is always concerned about minimal invasive surgeries and organ preserving surgeries. So this is our primary goal, even though there's a need for any type of intervention.
So in terms of the treatment options, can you tell more about it? Like we have medication, embolization, laparoscopic surgery, and open surgery. But from your perspective as an expert, one of the top experts, which treatment methods are the most effective from your perspective?
Considering that the patient is not at a stage for surgery yet, we try to control the symptoms. Most of them are either bleeding problems or pain. So for bleeding, we give antifibrinolytic treatments like tranexamic acid. For the pain they cause, we give non-steroid anti-inflammatory drugs, painkillers. And since they are hormonally dependent tumors, we give either, in cases it depends on the location, of course, we give progesterone intrauterine treatment of progesterone through devices. We give injectable oral progesterones or combined oral contraceptives. But still, these are only for controlling the symptoms. They can prevent the growth, but at the end, when the medical treatment is stopped, they try to grow during the reproductive ages. But for an intervention that the size is increasing, it causes pressure symptoms to the bowels or bladder. So we still try to do minimal invasive procedures. One of them is uterine artery embolization. That is what the radiologists, interventive radiologists do. They block the blood flow to the myomas, therefore they are not fed and they shrink in size. Or when we do the surgery as gynecologists, we do for the intrauterine subserous myoma, cystoscopic myomectomy, and for the others, which are mostly have a subserosal component or an intramural component, laparoscopic myomectomy. One more thing I need to make clear is myomas are classified according to their relationship with the endometrium, the inner lining of the uterus, and the outer lining, the serosa. So they can be subserous, which are near to the outer surface of the uterus. They can be intramural, that is, the most of the component is in the muscle layer, or they can be submucous, which is they are protruding towards the inside of the uterus. So the locations are classified according to that. So the type of minimal surgery that you do also depends on the location of the myomas or fibroids. And if it doesn't work, but most of the time we try to, as I told you, preserve the uterus, then there are classic surgical methods like abdominal myomectomy or abdominal hysterectomy, where all of the uterus is removed from the body. But this is the last resort, of course.
Amazing. That's why we need experts like you, which can make all these analyses and able to provide the right treatment options. So we're so happy to host you, Professor Dr. Başak Çetiner Baksu. Let's get to, since we have many viewers from Africa, let's talk about the situation among African women. You mentioned earlier, as the research shows, the fibroids are common, most common, actually more common in black women. Is this difference related to genetics or lifestyle factors?
As you have mentioned, studies show that consistently women from African descent have a much more frequency of myomas. These are most of the time, compared to the other ethnic populations, they have myomas at an earlier age, and once they have it, they tend to be much more bigger, and the number tends to be much more. So, therefore, there is a tendency. This is mostly related to two factors. One of them is genetic, the other is environmental and lifestyle factors. According to the genetic point of view, since these are hormone receptors, and since we see them at an earlier age in African descent women, this means there should be a genetic variations or mutations in the receptors for the hormones estrogen and progesterone that causes a susceptibility for the tissue to grow. Another thing is environmental. As a risk factor I have mentioned before, vitamin D deficiency is much more common in this population, and obesity is another factor because of the fat tissue being a storage for estrogen, and chronic stress or chronic diseases. So this is not only one factor, but a combination of both genetic and environmental factors that causes much more prevalence of the fibroids to be seen in African descent women.
Let's talk about public awareness as well, shall we, Başak? Because when I look at Africa and other developing regions, many women, as far as I know, correct me if I'm wrong, do not have regular gynecological checkups. So what are the consequences of this, and how can we together increase the awareness, and how can the awareness be improved?
Yes, you are very right, and this is one of the most important issues that in my career as a physician, as a woman, as a gynecologist, that I want to make awareness of well women to be a priority. So, unfortunately, just like in Türkiye, which is a developing country, in most of the developing countries, and as much as I know in Africa, the awareness of myomas, fibroids is very limited. Of course, this relates to some common factors like people have no access to the normal gynecologic examination. And there is a silence about talking about reproductive health in the populations, because cultural taboos, education, and misinformation enables these women to apply to a physician, not in the early stages, but only when they cannot stand the symptoms anymore. So the awareness is limited, but most of the time education of people having access to normal gynecological examinations, like maybe public offices or mobile health services, increasing the access to these, and also having people to feel free about talking their problems related to the women's health, and educational programs in the schools maybe, or the government, local authorities working with the media. These are a combination of how we can increase the awareness of women to seek for help and to talk freely about their problems before they're at a very late stage.
I think you gave amazing tips about how can we increase awareness for all the viewers here, including decision makers in Africa. I want to thank you again. Maybe, hopefully in the future, we'll go to Africa together and also create some more programs about awareness to serve our women in Africa. And as a final quote, in terms of your recommendations, I'm very curious. You know, we have many wonderful women living in Turkey and Africa, and you know, I'm a family medicine physician, and it's all about prevention for us, preventive medicine. From your perspective as a top professor in obstetrics and gynecology, what lifestyle habits should the woman develop to prevent and also to detect fibroids early?
This is actually the most modern approach to medicine in general, what you have taught. Right now, we are not looking from a traditional gynecologic women's health point of view. We are looking with a much more pragmatic perspective, and women's health is not only treating diseases or taking care of pregnancies, but preventing diseases, making them aware through education or having screening programs, feeling them free about to talk their symptoms, feeling happy with their bodies, with their sexual life, with their gynecologic organs. So it is not only not being physically well, but also mentally, emotionally, and socially well. So this is my motivation while I am doing my medical practice. So the lifestyle changes is what we most of the time offer before any type of treatment. This includes having a normal body weight, having a regular, well-balanced diet, and in case of the myoma, having fruits, vegetables, and grains in their diet, and limiting red meat and also processed food is as a diet advised. Another lifestyle change is having a regular exercise. It balances your hormones in case of myomas, and dealing with stress, because chronic stress is also one of the risk factors. Having a good quality of sleep and being away from bad habits like smoking and alcohol. And for one more thing, maybe be careful about your vitamin D, since we are talking about women from African descent. So maybe it will be good to measure their vitamin D before taking it, because you know it is one of the stored vitamins. So continuously taking might also have side effects. These lifestyle changes is what we, in modern gynecology, offer women, not only in your field, but also in our field.
Absolutely. I was so excited to see you, and this topic is so important for women's health. I just jumped in to the subjects, but I didn't have a chance to ask about yourself for our viewers. Can you tell a little bit more about yourself, your education? Because our viewers, I'm receiving many messages. They want to connect with you. Can you tell a little bit more about yourself? How can our viewers reach you, and your education and your work, your amazing work in Istanbul?
Thank you. I graduated one of the actually best medical schools in Istanbul, Istanbul Medical University, which I'm very proud of. Then I started normally, first I started dermatology as a specialist, but I quit half of the training because I wasn't very satisfied. So I thought maybe I would go into some surgery type of medical training. So gynecology came afterwards as my second specialty. So in 2000, I became a specialist in gynecology, and I have worked 20 years for the government in training and research hospitals in Istanbul, in several of them. Then after that, for 7 years, I worked at a private hospital. Now for the last 2 years, I have my own office, which was my goal when at this stage of my career, I would do my own business and take my time with the patients and to care for them, to talk to them according to the time that I would like to, because Istanbul is a very populated city and the government hospitals are very crowded. So this is what I am at this point. Happy to do what I would like to do, sparing my time for the patients in a much more convenient environment.
Thank you so much. It's amazing to see, to follow your passion. And I'm inviting all my African viewers to connect with Professor Başak Çetiner Baksu. She's one of the top obstetric and gynecology specialists in Istanbul. Definitely you can reach out to her, and I think you'll get really a good gynecological exam as well as get a true understanding of all your women's health. So thank you, Başak. I'm so excited. I know this is the first, but hopefully not the last. I look forward to having more programs with you in the future. Thank you very much for being with us. Thank you.
Thank you very much for hosting me, for the nice moderation you did, Dr. Yavuz. Thank you very much.
Thank you. Take care. Appreciate it. Ladies and gentlemen, I had the honor to bring very important people from all walks of life. Especially if you see, we have also the breast cancer awareness month. So we are focusing on women's health because women are very important for us, especially in Africa as well. That's why today we talked about the silent threat in women's health, in fibroids. And as the AFROTURK TV managing partner, this is Dr. Yavuz Selim Sılay. Very excited to hear amazing backgrounds from you about how global health has become one of the top shows in Africa. This is Dr. Yavuz Selim Sılay. Stay tuned to Global Health at AFROTURK TV and AFROTURK Agro TV. Take care and all the best. Bye.